Hi, guys, it's Dr. Sadaf, and I just wanted to give you an update as to what is going on. So, I have opened up my practice in Chappaqua, New York, and I'm currently accepting new patients. So, I want to invite you to come and become a patient of mine. If you've been listening to this podcast, you've been listening to the episodes, you are finding so much value in all of this. I want to invite you to become a patient of mine and come see the difference with a doctor that actually has time to listen to you and support you through the transitions that you may be experiencing, whether they're perimenopause, menopause, or you're experiencing any type of sexual dysfunction. And of course, I do annual GYN exams as well. So if you're not having any problems at all and you just need a regular exam done, I am more than happy to help you out. So make sure you check out the practice. It's called FemV Health, and the website for that is www.femvhealth.com. And make sure you look that up. The phone number for the practice is 914-538-2534. And make sure that you go and check it out. Check out the website and make sure you book your appointment today. Also, I have just started a new Facebook group. It's called It Might Be Menopause Support Group by Dr. Sadaf Lodi, FemV Health. And I'd love for you to come and join that Facebook group, because in that group, we'll be talking about different ways that you can get support and education as you go through this important transition in your life. It's also about building a community that is going through the same things that you are. Oftentimes we feel that when we go through things in our life that we are the only one, but I'm here to tell you that you are not alone, and that there are so many other women going through the same symptoms that you may be going through, whether it's hot flashes, night sweats, mood swings, vaginal dryness, pain with sex, brain fog, joint pain, dry eyes, any of those things, so come join us in that Facebook group. It's called It Might Be Menopause Support Group by Dr. Sadaf Lodi, and that's on Facebook. So come and join us in that community. And I definitely look forward to welcoming you there. And make sure that if you have any questions about any of the podcasts that I do, that you either DM me or email me, and I will create a podcast just for you, because you are a loyal listener and subscriber, and I would love to answer any and all of your questions. So if you have any burning questions that you are wondering about, please make sure that you email me at hello@femvhealth.com and let me know about your questions, or DM me on Instagram or TikTok, and I'll create an episode just for you. And as always, make sure you like, share, and subscribe to this podcast. As you know, I am looking to get over 100,000 downloads by the end of this year, and I'd love for you to help me out in that endeavor. And so please share and like these podcasts, download them, and let all your family and friends know, because I know there is not much information out there, and some of the information out there is not actually factual. So you want to make sure that you are getting your medical information from a board certified OBGYN that knows and has studied all of this material, whether it's sexual medicine, perimenopause, or menopause. So looking forward to hearing from you. And now to the episode. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodi, and this episode is everything you need to know about body image and plastic surgery and what that means for your relationship. But before I get into it, the first thing I want to make very clear is that I'm not giving any type of medical advice. So if you have any questions about plastic surgery or any of those things, make sure you go and speak with your healthcare provider. And of course, as always, I'm not giving any advice on religion. So if you have any questions about your religion, make sure you ask your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So on with me today is an esteemed plastic surgeon that I've had the privilege of knowing for a very long time, Dr. Mahjabeen Hassan. Dr. Mahjabeen Hassan is in New York. And for those people that may not know you, Dr. Hassan, could you introduce yourself to the viewers and the listeners?
Sure. So, like you mentioned, that I am a plastic surgeon, so I'm board certified not only in plastic surgery, but as well as in wounds, so double board certified. I have been plastic surgeon for over 40 years now, and my practice has been changing somewhat, but it is not as much as aesthetics as I used to do. I have become more of a reconstructive surgeon as well. Not that I don't do cosmetic surgery, but cosmetic surgery itself is also changing in a significant way. The amount of facelifts we used to do or other procedures which have reduced, and now we have gone a lot on to the injectables which are improving. Plus, there is much more laser which is being used to tighten the skin, so it depends upon what aspects of plastic surgery one is dealing with now, as of this. So, like I mentioned, it's very broad. Do we still do nose jobs? Yes. As many as we used to do? No. But just because we can even make the nose a little bit better just by the using the injectables. So yes, the plastic surgery is significantly improving, and now there are laser treatments as well, which also cause very nice effects on the skin, tightening it up, and very mild effects on it. So when I look at plastic surgery from like going back and now, a significant difference has taken place.
Okay, that's fantastic. So, oftentimes we think about when we think about plastic surgery, we think about, all these very drastic things that people are doing to themselves. So, what is the trend that you've noticed, perhaps from when you first started? Like you just said, you used to do more facelifts and, maybe more I don't know, maybe you did more nose jobs at that time, but now you're doing less of those things. So, what is the trend that you've seen perhaps in your own practice?
Yeah, so in my own practice, like I am very upfront with the patients. I do not believe in drastic change. I believe in subtle changes, which makes the looks like, oh, you look good, but I really don't know which aspect has changed you. And that's what my aspects are regarding cosmetic surgery. So, like I said, the plastic surgery is not only cosmetic surgery, it is also reconstructive surgery.
Mm-hmm.
So it depends upon which aspect a patient, people or who are going to be on would like to know more about. It will be whether cosmetic or reconstructive. So then I can answer those questions well. Um, but yes, the trend is less is better.
Mm-hmm. Okay. So I know that for a lot of women, as we age, we really seem to focus on our body image. And a lot of times when we are so preoccupied with that, I think it's hard to focus on the relationship in, different aspects of intimacy and things like that. So do you find that people that come to you, have a lot of issues with body image? And then how do you help them with that?
So I'm going to start with a very interesting case, and this had to be was a guy. He came to my office, very handsome, tall, and looking, but he was not carrying himself as if the height he had he would use it. So I was wondering, why is he in my office today? So I asked him, what can I do for you? So he pointed toward his ears. And apparently, there are some ears which are a little bit more forward. I mean, so they have weak cartilage, with the result that it looks like I wouldn't call it, but sometimes like a bat ear. So I said, okay, yeah, that can be done. And the next time when he came after the surgery and all, he literally, it felt like he grew 4 inches, because now he was carrying himself so well that the height which he had not used it, and now he was looking great. And like I said, it was not a major procedure, that ears done can be done easily. And yes, it made that much of a dramatic effect on him. And similarly, when it comes to breasts, the breast reduction or augmentation, that too makes a significant difference in patients, how they carry themselves. You can see their smile, you can see, look at their face and eyes. They all look like, okay, they're back into life again. Um, Now, also with weight reduction, now we have so many things coming in which now patients can use or inject and have the weight reduced. That itself is also making big changes. In fact, a patient I saw just day before yesterday, and I said, "Wow, you really look good. How did you do it?" So she's on Ozempic, and I think Ozempic is now helping. And I do not know how far it will go, but for the moment, it is being used for weight reduction also.
Right, right. Yes, there are a lot of people we've had on in the past that do obesity medicine that talked about Ozempic and Wegovy and a lot of those medications that help with drastic weight loss. And you're right, that absolutely affects a person's self-esteem. It makes them, feel better about themselves. And I think that ultimately, when you feel better about yourself, right, you're going to be able to present yourself better, just like that patient that you had, that gentleman that came in for his ears, right? He was perhaps he didn't feel so confident. And so now once he had his ears done, he felt more confident about himself and, felt better. And then he's probably showing up better in his relationship. So I think that, plays a huge part. Do you find that patients that have a lot of issues with body image, that they have a lot of thoughts about the way that they look or the way that they should look? And how do you counsel them about that?
So my way would be first, listen to them very carefully. And in that, one can find out where is the area which they are most disturbed about, and whether it is they or whether it is being told to them by a
Yeah.
family member or somebody else important in their life. So, my first consultation is really listening to them. What is it they are looking for? And it's not like, oh, yeah, I can change your nose. Oh, yeah, I can do your ears. I can do this. I can do that. That is not my way of handling or talking or accepting a patient in my practice. It is, let me hear you out. And then one can figure it out. Okay, this is how far I would like to go and not further than that. Some patients really want dramatic changes. So I am very honest with them, very upfront for them, because I feel once you do that much of dramatic effect on it, it throws their personality off a little bit also. So
Mm,
whether they are accepting themselves or not, that is very important. So you may spend thousands of dollars and then realize that you're still very unhappy about it. And then whether or
mm,
not a finger is pointed to a plastic surgeon becomes very important. So one has to be very careful which patients you would accept. And I do not know if you have ever heard of it. There have been some suicides. Plastic surgery has a little higher rate than other fields just because of their image has been distorted.
oh.
So you have to be psychologically also up with it.
Oh, okay. Very interesting. So,
Mhm,
both you and I are Pakistani, and I
mhm,
know that, in the Pakistani culture, there's a lot about color, right? Color of the skin. That's
mhm,
kind of ingrained in us, maybe perhaps because we were colonized by the British for so long.
mhm,
And, that the color of the skin really matters. And, they think that the more fair you are, right? The lighter your skin, the
mhm,
more beautiful you are,
mhm.
and the darker you are, perhaps you're not as beautiful. Do you ever encounter that? Do you ever see that in your practice? People come in, and I don't know if they ever, I know, in Pakistan, you go there, you visit, and you always see like these billboards about making your skin more white,
Mhm,
right?
mhm, mhm,
Do you ever
mhm.
find that? Did you ever notice that in your training?
There have been few patients. I think maybe it is the area where I'm located. I'm in Westchester. I am surrounding more by white skin. When it comes to brown or black, I don't get. I have some patients. I have treated all of them, but they are not as many. So I think it is the demographic also makes a difference. Where it comes to patients who are, when we say Afro Americans, their color of the skin, some accept it, some don't accept it. The question then becomes, how light do you want to be? And what techniques would be used for that? I have done some like for chemical peels and all, but now lasers are very much playing a big role in it. So yes, it is being considered for some color difference, a slight reduction in the pigmentation, but not tremendously. So it will be maybe a shade or two lighter.
Yeah. I find that, so growing up, when I was growing up, I grew up in Michigan. And I remember at the time when I was still single, there was, when marriage proposals would come and things like that, the parent, I don't know if you've ever heard this, but I know it was common. I know that a lot of people used to hear this, but is that they, the guy's family always wanted somebody that was more light, somebody that's fair, somebody that's, they had all these requirements and things like
Mhm.
that. What do you think about that in say like the Pakistani culture? I think personally, I think that's very wrong, and I think that that's ridiculous actually. But I feel that we as Pakistanis, we tend to do that a lot, with the color of the skin and all these requirements and this and that.
Yeah, I think it was, I visit Pakistan once a year,
Yeah.
and I have seen change. The younger generation are a little bit more acceptable of themselves and they carry themselves better.
Mm.
Um, whether or not they have done any procedures and all, if they have done it, it has been done well, because I cannot tell dramatic changes in them. Uh, the others who are a little darker, but if they are confident in themselves, they carry themselves well. And I think the makeup which is now being used is also much better than what it used to be. It is much finesse, and it does not show as much like as somebody has really plated themselves up with heavy makeup. So even in Pakistan, I'm seeing the change is taking place. But yes, still, like we say, the rishtas, gori ladki mil jaye to acha hai. So that is unfortunately still there. Yes.
Yeah. Yeah, and so for people that may not have understood that, so that, Dr. Hassan was saying that, people often say that, if you can find a fair colored girl, that's always a better marriage proposal, which we know is not the case. But for some reason, I feel that a lot of times in our culture that tends to be the case, and there's tends to be an emphasis on that. And I'll hear people talk and they'll be like, oh, she's pretty, but, she's really dark. Or, oh, she's beautiful because she's so fair. So I don't know. I still hear that. I visited Pakistan recently, and that always seems to come up. So I don't know, but I think it probably depends on region as well, right? Maybe if you're from I'm from a smaller city in Pakistan, then perhaps you are. So maybe that doesn't. And I think
Yeah.
education plays a part in it as well. So as a plastic surgeon, how would you recommend to people? What are your first steps? So when somebody comes to you and says, I'd like to change everything about me. I don't like this, I don't like that, this and that. And what are some tips that you give to patients? Because it may not just be that, they find something physically, but emotionally and, psychologically, they may be struggling with self-esteem, and they just, for some reason, and then people also have that body dysmorphic syndrome, right? Where
Mhm.
even after they lose weight or change, they still see themselves as what they were previously. And if they found themselves to be unattractive or something like that, they still see themselves as that.
Mhm.
Can you maybe talk a little bit about body dysmorphic syndrome, and how have you seen it?
Yeah, so the first consultation, I would say, is much more on understanding the patient.
Yeah.
Where is it coming from? What has really happened in their life? What aspects of it? Almost you become a psychologist at that time. And you listen very attentively. And then you realize, okay, either it has been trauma, long time back, which they have almost forgotten about it. Somebody remarked it. That has, I've heard quite of it. Somebody said, oh, look at you, how dark you are.
Yes.
And that is a really stabbing kind of an injury to your personality.
Right.
So in those patients, you have to show them the mirror in the sense, the way it is. Look at this, your eyes are so nice. Look at your nose, look at this. So you define every aspect of their figure as well as the face, and you can see them relaxing. And it is amazing, once they relax, the face looks so light and nice, and you can see that they have suddenly found themselves, oh, okay, I'm not as bad as I thought I am. So
Mhm.
then you go through the various aspects. You have to take the photographs, the angles, and all, develop them, look at them, and then look at together. And then the patient themselves will guide you which aspects of the facial areas or the rest of the body is what is disturbing them.
Yeah.
So I think the most like is like you have to be a psychologist as a plastic surgeon.
Mhm. Yeah, I can see that, you know. So what about the body dysmorphic syndrome? So say, you know, you do surgery on somebody and it turns out perfect, right? And everything looks fine and it's exactly what they wanted, but then they're still like not satisfied and they still see themselves as, you know, perhaps all the faults that whatever they thought before, they still see all those. What do you do for that?
Yeah, before I go and describe that, I'll tell you about an incident which had happened, and a young guy who had taken his own life after plastic
Oh,
surgery.
no.
In fact, there are more plastic surgeons are shot or killed
Oh my God.
because of because of that aspect, that what they thought would happen to them did not change that dramatically, or what changes were not acceptable. So they have come into the office and they have went ahead and shot the plastic surgeon. So some of
Mm,
the plastic surgeons in some areas are becoming a little bit more careful, who enters into their area. So
of
my
course.
point is that even if you make a change in somebody, and that change is not what was in their mind, the way they should have looked, it can be pretty dramatic sometimes.
Mhm.
Thank God it's not often, but it's there. If you look up in the history, you will find it. So how would I change a person's its self-image? First of all, it is whether or not what they're asking for is really right there. Meaning, yes, I can see these are the aspects which I can do and help you with that. Some will accept it, some will not accept it. So you have to be careful where will you say, okay, this is how far I will go. This is what the changes I can bring to you. But if I feel like this patient is still not understanding, you can see it in their eyes and all, whether they're really listening to it, whether they have accepted your reasoning, then it becomes a aspect where you have to be carefully saying that, you know what, I will try to do my best, but maybe another surgeon might be the best for you. Why put it yourself in an area where you feel like this person literally does not have a good body image at all? Now,
Mm.
it could be breast, it could be abdomen, it could be the weight. There are so many aspects about the body which they could be looking at. And for you to get into them and see the patient through their eyes, that takes time, and see whether this patient is really up there mentally, also mature, before you undertake them as your patient.
Yeah, I'm sure you probably really have to select your patients carefully, right? To see if
Absolutely.
they're gonna be somebody that will be satisfied with the results because
Mhm.
I never realized actually that, you know, there's a lot of, you know, there can be some homicide there and,
Mhm.
you know, especially I can see patients, you know, that are really trying to change their whole body image or really how they look, and if they're not satisfied, I can see how that would really impact their, you know, mental health. So,
Mhm.
really interesting. I never thought about all those different aspects of, you know, picking patients and seeing how they will do and whether or not they're a right candidate, right? And you're right.
Exactly.
Maybe you're not the surgeon for them. Maybe they need to go to somebody else that can give them the
Exactly.
results that they're looking for
Mhm.
and, you know, create happiness. You know, so much of what we know that is, you know, happiness really comes from within, right? It really comes from being at peace with yourself, at, you know, peace with the person that you are, and really your thoughts.
Yeah.
And with coaching, I do a lot of that.
Mhm.
When I talk to patients or clients, rather, I talk about what their thoughts are. And I read an interesting book one time, and it was a book by it's called Soundtracks, and it's by this author John Acuff, and he talks about how when we have like these negative thoughts in our head,
Mhm.
we play them, they play in our heads like a
Mhm.
soundtrack, and we hear them
Mhm.
over and over again. And
Mhm.
so the way to counteract that is by doing positive affirmations. So telling
Mhm.
yourself every single morning, like,
Mhm.
I am a good person. I am whatever it is that
Mhm.
you're trying to achieve, whatever it is that you're trying to change, that soundtrack in your head, that you work on that every single day. And you do that by looking at yourself in the mirror and saying that.
Mhm.
And I wonder, how that could be helpful in your practice, with patients that come in and perhaps have a really negative self esteem and body image, how that might be helpful for them.
So that way you have to go back into their ages ago. What happened? Who was the person who said something to you? Or was it within your family, your mother, or somebody, or a close friend, or somebody you had just got friendly with and just they picked up one aspect of you which you knew is very sensitive, and that they talked about that or mentioned something about it. Then you have that time you're now totally a psychologist. You have to literally go in and find out what really happened, and then you analyze it, break it down into small little bits, and then they start to see themselves a little bit differently. The positive aspects about themselves we have of them you have to show them, because even within the first 10-15 minutes you can almost see what this person is all about. And sometimes they will just come back again and again just to talk to me about, they have not yet done or not accepted that they were going to have it done, but I think the conversation felt like, oh, okay, I understand what you're talking about. I should really look at this aspect of myself in this. So that helps out. I don't accept the patient right away. I don't even tell them right away, okay, I can do this, and you will be fine. No. So sometimes I will take more than one or two visits before we decide as to what the reason they had come for. And then
Yeah.
talk on that aspect, whether it is nose job or the ears or the eyes or whatever aspects, and the neck, all those aspects of it. And especially the weight is another issue.
Yeah. Yeah. No, that makes sense, right? You want to make sure
Mhm.
that when you're picking the patient properly, but also that the person, right, doesn't have so many other things going on, such as like baggage or trauma or
Exactly.
abuse, verbal abuse that they may have experienced in the past that they first need to overcome, right? They need to first
Mhm.
learn to love themselves as they are right now before looking to plastic surgery or whatever that they're
Yeah.
trying to change, because even after the change occurs, they may still not love themselves, right?
Exactly. Oh, yes, absolutely.
And absolutely, and still finding faults with themselves, and then finding
Mhm.
faults that, oh, you didn't fix this, you didn't fix
Mhm.
that. But
Mhm.
the real
Mhm.
problem
Mhm.
is
Mhm.
that they are just not happy with themselves in
Yeah,
general. And so they, like you said, perhaps they need to speak with a therapist, a psychologist, or something to kind of unravel all of that baggage and trauma that they've experienced in the past so that they can move forward, right? It's hard to do that.
exactly. Exactly.
Um, when you have so many things in your head that are going
Mhm.
on. So
Mhm. Mhm.
fantastic.
And for a plastic surgeon, it becomes very important selection.
Yeah. Yeah.
Whether you can really do what they are asking, is that reasonable or not, and all that before you accept. Yeah.
Sure, sure. So when you were talking about reconstructive surgery, what type of reconstructive surgery do you do? Is that with women that have perhaps had breast cancer, so you reconstruct like their breasts, or what type of surgeries are those?
Yeah, reconstruction is a huge field. Like you said, one can take about the breast itself. Yes, breast has
Mhm.
been taken off, mastectomy has been done, you have to reconstruct it. That's reconstruction, a very standard. But there are, as far as the concern, trauma can be major effect on a patient. I'll give you an example. This was several years ago. It was December, near Christmas time period, and I was called at 2 in the morning that you have to come. And so what really happened? Well, the dog bit the lip off, the lower
Oh my
lip.
God.
And the
Oh
whole
God.
entire middle thing was gone
Oh
at
God.
2 in the morning. And the best part was it's Ramadan. I was also about to have my sehri and all that. So anyway, so I rushed to the hospital and I said, yeah, the entire this portion was completely gone.
Oh my God.
Now I know how to reconstruct it, but nothing can be made as beautiful as a normal, natural middle part of a lower lip. So I asked the patient, I think, or the family, I said, could you go and see if the dog has spitted it out? And they were
Oh,
surprised. They said, what? I said, no, usually they will take it off, but they'll spit it. So they went back. Yeah, they found that whole middle third of the lip.
wow.
So now, thank God, by that time I had been a pretty experienced physician. Otherwise, I would have said, oh, nothing can be done. But I know that lower lip has a lot of blood supply. And
Oh,
therefore, after I had debrided it in a particular way and put it back, couple of months later, you wouldn't even know that this lip was reconstructed. So there are
amazing.
many aspects of reconstruction which we do. Like for the ear, there was another example. This was also a lot of things happened near Christmas. There was an argument, and the lover just took this teeth, put it on the ear, and just ripped it off completely, completely.
Oh
So
my
this
God.
is again a two in the morning case. So right now, I was just a plastic surgery resident. I was not even attending yet. So I
Mhm.
look at the ear. The entire ear was right in the palm, like that,
Oh
full.
my God.
What am I going to do with this one? I am still in training. So I called the plastic surgeon on call. I said, it's 2 in the morning. So he says, I'm sorry, I'm not even in the area. I said, well, so what am I going
Wow,
to do with this patient? So
that's
he says,
crazy.
just tell him nothing can be done. I said, nothing can be done? I said, what? This, how can I tell the patient this? Like, nothing can be done. This is most painful aspect to him. So I went, took the ear, I put it in his hand. I said, the plastic surgeon is saying he can't do anything. He got
Oh,
so mad, he ripped the ear from my hand and walked out. Now, this
wow.
is when I was under training. Later on, once I became, fully trained and read, what would I
Mhm.
have done in that case? And I have done it. What we do is we will make a pocket in the back of the ear between the
Mhm.
hairline and this is a whole skin which has no hair. So you
Mm.
take the ear, you take away all the skin out because it is the skin which has the antibodies which will destroy if you put another skin, right? Because that's how
No.
we are survived. So you have to take the skin off and put the entire ear just the way it is in the pocket, stitch it, and leave it for about 4 to 6 weeks. It will have the
Mm.
ingrowth of blood vessels, and then you very gently lift it up and just put a graft in the back, and now you have the ear completely right there. So when you
Wow.
come to reconstructive surgery, there are so many different things will happen which you may have never done, and you have to just figure it out how to figure do it. What are the basic aspects of plastic surgery which we know A, B, C, D, and you try to fit in that and get it back.
That's amazing. I don't think I could do that. I deliver babies and we do stuff like that, but thank God we don't have to do that. Gosh, that sounds awful.
Oh yeah.
I'm so glad there are people like you that can put that together because
and,
that would
and,
be
and
very
very satisfying, but it's so satisfying when the patient walks away and yes. Yeah,
sure. Oh my God. They have their ear again. That's
yeah,
huge.
yeah,
Ear again, lip again. Wow, that's amazing. Well,
yeah. Even
thank God.
nose, the nasal
Yeah.
tip, you know,
How'd that happen? How'd the nose fall off?
bite.
From Oh my God.
Yes,
Ugh.
it's amazing. It's so many. The things I have seen in plastic surgery, it's just unbelievable, unbelievable. I'll give you another one, very very interesting case. I'm
So how do you
still
attach the nose? Okay, you have to tell me about the nose though. First, you tell me about the nose.
okay.
How do you attach that?
This portion is just again bitten away.
Oh,
The
poor
anger
people.
in a person is just so much. I can't even. They become like animals, literally.
Yes, yes.
You just go
Oh,
and put the teeth and you just rip it away.
oh,
So then,
awful.
yes, it could be human. Plus, I had done quite a few dog bites. Dog
Ah,
went into the nose and just ripped it off. And this
ah.
was only as recently as last year. And this patient has become my best friend because I was
Yeah.
able to put back her
Yes. Would be my best friend too. What the heck?
Yes. So, like I said, it's not only human beings, even, I mean, the animals and all. So, yeah, so the basic aspects, once you learn the reconstructive ABC, then even though you may not have done something before, you'll be able to figure it out.
Yeah,
Yeah.
yeah. So what was that other case you were going to tell us?
Oh my God, this was so interesting. So, again, I'm still a resident, and it's two in
By the
the
way,
morning.
whenever a doctor says it's interesting, it means it was horrible.
Yeah,
That's
so
what
I,
interesting, that's a code
it is,
word.
yeah, interest
Interesting
is
means,
good
oh
not
my
to be an
God.
interesting patient. It is good
Yeah,
to be
yeah.
not an interesting patient. So it's again
You
2
never
in the
want to be an
morning.
interesting patient. I
Yeah.
said, you never want to be an interesting patient.
Yeah, no, you don't. You don't want to be an interesting patient. So it's again 2 in the morning. I get a call and they say, you have to come right away. I said, what is it? Oh, yeah, you just have to come. Okay. And at 2 in the morning, you get up, you're barely opening your eyes. You've been working the whole day. And the hospital was under construction. So I'm going through a corridor which had a blinking light. So I'm going from the darkness and go to the ER. The door's open and I'm looking at a patient who's sitting like that, looking at the door like straight. I said, now what is this, right? So again, I'm trying to clean my eyes up. Am I seeing something unusual over here? I go over there and I see a knife, whole knife, dagger going through his between the nose and the eye in.
Oh my God.
And what I'm looking at is the handle. I said, my goodness, what happened over here? Of course, it's a lovers, night
Oh
crawl,
God.
a fight, and this patient just took the knife ends and just put it through it.
Oh, oh.
And I'm saying, oh my God, what? How am I going to? Again, it is around Christmas time. Which
Everything's
attending
at 2 a.m. at Christmas time.
is
Be careful, 2 a.m. Christmas time.
exactly. Okay, so let's do an X-ray. So do an X-ray, and the entire blade is in. And I'm saying to myself, how come he has no effects on the legs or arms or anything? He's just sitting very comfortably. So I call my attending. I said, listen, this is the case. He says, nothing can be done. I said, what do you
Oh no.
mean nothing
Was
can?
he out of town again?
Yeah, I wonder where he was. No, nothing can be. I said, no, no,
Oh
no.
my,
The patient is here. He's sitting. He wants something to be done. So
of
let me do
course.
the X-rays and all that, and then I have to get the cranial surgeon in. I have to get the anesthesiologist in. I have to get all that. I have to do all the blood, so that if he bleeds on the table, I have enough blood and all right for the surgery. Because I'm just a resident. I just know the basics right now. He got so mad, he walked out. I said, where are
Oh my
you
God.
going? He said, I'm going to go and take care of her. I said, oh, he went with that there. So I do not know what ever happened to him. I
So
did not go
he
after
left
him.
with a
He
dagger
left
in his face.
with the dagger in the face like that.
Oh my God. And he was going to go take care of what?
Take
His,
care. Of course, the one who he had a fight with, he said, I'm going to go and take care of her. So,
oh my God.
God,
That's
I don't
awful.
know what ever happened, but that's why I said it was
Oh,
very interesting.
God, it's crazy. You have had some really interesting cases. Listeners, don't ever be an interesting case.
Yeah, yeah, that's the basic aspect.
Yeah, well, oh, wow, amazing. So thank you. Well, so what is one last pearl that if somebody's listening to this, they would take away and they'd be like, wow, thank you so much. What is one advice or pearl that you would give to somebody listening to this podcast?
Yeah, so of course it's plastic surgery we're talking about, and the person would like to have some changes or whatever aspect of them they are unhappy about. The best thing is to go ahead and have a very serious talk with the plastic surgeon, meaning got to know that plastic surgeon also. If the person is very excited, yeah, yeah, I can do this for you, this for you, this way, and this is the bill. Okay, this is what it will cost you. Then be careful because I will tell you, unfortunately, all of us are not very honest. And therefore, it's important at that time when I do the photographs, sit down and also ask the patient to come back for a second interview. Not in the first one, do you take any decisions. So by second time, they have looked at their faces, then I can analyze it. As you see, this aspect, if you have it changed, This is what it will do to you. Do you really need to do everything? What are the good points which are already there? So I will point that out to them. You see, this is very nice. This is very good. Oh, yeah, okay. Only this, if you do it, you'll see it. So this way, you are making the patient think about it, look at themselves again from a different angle. And then that becomes easier for the surgeon and for the patient. And therefore, you will have less disappointed patient. And if you're really looking always financially, then I'm sorry, you may get into trouble.
Yeah. Yeah. Well, that's a great, piece of advice is that to make sure that, you're really sure that you want something done. And if you do, make sure that, you find the correct surgeon and
Hmm.
that you have a good relationship with them and have clear expectations, right? Of what
Hmm.
you want the result to look like, what you want it to be, and, and make sure that you'd be happy with whatever ends up happening, right? Because once you get surgery done,
Oh,
that's
yes.
it,
That's it.
right? I mean,
That's
it's
it.
final. That's
Yes.
it. So you have to
Yes.
really be sure.
Yes.
And make sure you don't get into a fight on Christmas at 2 a.m. and call up Dr. Hassan because that's when all of our trauma comes in, is at 2 a.m. on
2
Christmas
a.m.
time.
Yeah.
Yeah, that's right. That's right. All right. Well, thank you so much, Dr. Hassan, for coming on this morning. It was a Saturday morning at the time of this recording. So thank you so much for coming on and sharing your expertise and all the knowledge that you have and all the years of experience that you've been doing this, and what you've seen throughout. So thank you so much for coming on. And of course, this is not meant to be any type of medical advice. Oh, by the way, Dr. Hassan, if somebody is interested in seeing you as a patient, how can they get in touch? How can they come by and see you?
Yeah, sure. So I'm located in Westchester. So what they can do is they can see my name. There is phone numbers and all. I can also give it to you. So they will just call my office, make an appointment. And the first appointment is just that, a conversation, trying to know the patient and what needs to be done, what can be done. The second conversation will be much more precise just for them.
Okay, excellent. All right, very good. And of course, as always, this is not meant to be medical advice. So if you have any questions about your image, or maybe you want to get some reconstructive surgery or plastic surgery, make sure you go and speak with a board certified physician so that they can help you out and help you make the right decision for you. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.